Hey guys, Dr. Brian Anderson. I hope that you are doing well. Today we're going to be talking about testosterone dosing. And I saw a lot of you left comments regarding one of my previous videos about testosterone and replacement and why low-dose testosterone might not be the best idea for everyone. So before we get started, as always, ask your doctor or healthcare professional about your specific treatment. This information is not to be used as formal medical advice. So let's get started. So part of testosterone replacement involves actually replacing the level of testosterone that your body should be making, right? So your level should be low, ideally, before you start replacement. Normally, testosterone, when we're 18 to 20 years of age, will peak around 1,000, 1,100, and then as time goes on, our testosterone tends to drop. And then for some people, maybe yourself, your level drops prematurely, and then you have symptoms including low libido, low sex drive, low muscle mass, low metabolism, poor motivation, poor drive. Part of replacing is bringing your level up to a physiological level so you feel optimized and those symptoms are gone, right? So part of replacement also involves dosing appropriately. And this is the question that a lot of you had is, what dose do I need? And so full disclaimer up front, we all have different levels of testosterone. So at age 18, you may have had a testosterone of 800, you may have had 1,000. So what, right? We'll never be able to go back in time and figure that out exactly. And this is very personalized. This is personalized medicine, not something where everyone takes the same exact dose. So there are some good starting points for most people, but again, it depends on you and your body's chemistry. So looking at things like sex hormone binding globulin or SHBG is a good idea because that lovely protein binds up part of your total testosterone and leaves you with your free testosterone. And your free testosterone is the part of the testosterone that interacts with your receptor sites to give you a benefit from TRT or testosterone itself. So we can bind up testosterone with age, and some people, even at a young age, due to trace mineral deficiencies, stress, genetic factors, idiopathic things, which basically means we do not know exactly why, we can have higher levels of SHBG, therefore meaning that those types of individuals may benefit from higher levels of testosterone replacement than those with normal levels of sex hormone binding globulin. So yes, we do need to check that level to see what the calculation for the free testosterone will be. And so I see patients sometimes in their 60s even with low SHBG, which require very low doses of TRT. And so conversely, you can also have a 60-year-old man that has high levels of SHBG. Maybe it's cortisol and stress, maybe they're stressed out, maybe again, genetic, nutritional, boron deficiencies, what have you, and they may need higher levels of testosterone replacement. So that being said, it is individualized. And with that, what are some good starting points? So first off, getting blood work to see where your levels are, step one, right? Assuming you have symptoms. And yeah, you do need symptoms to be on TRT. I mean, that's kind of how this works. You're feeling great, your levels look great, there's no reason to be on replacement, right? So looking at that, most men, if you look in a primary care setting, which is usually not ideal, most men are started on 100 milligrams of testosterone and cypionate 1 day a week. And so the ester on cypionate is to allow that testosterone to stick around longer in the body so it's not broken down. So if you did not have that ester and you gave someone testosterone, they could theoretically metabolize all of that testosterone in 1 day. So there are different esters and different types of testosterone, but testosterone cypionate, testosterone propionate, those are the prescribed in the United States. So cypionate is the most common form. And so with that, the half-life typically is about 7 to 8 days. So most men by primary care doctors are replaced at 100 milligrams for the whole week. And in my experience working with tens of thousands of patients over a decade now, I've kind of started to realize that 100 milligrams for most men that are active is generally not enough. So meaning they still have all the symptoms that they started with. In fact, I hear that a lot. Patients that have been on TRT before are coming to our office to see one of our providers or myself. They'll say, you know what, I started TRT, but I felt great usually for a day or two after my injection, and then I felt terrible for the rest of the time, so it wasn't worth it. And so what we're finding is that men typically, especially men that are active, typically need higher dosages than 100 milligrams once per week. So that brings us to our next kind of crux, is dosing frequency. And so usually twice a week dosing, like Monday, Thursday, some split like that, typically allows for more steady state testosterone. You still get a peak, you still have a valley, but your peak is not as high and your valley is not as low with your testosterone level. So meaning those receptor sites are saturated with testosterone, and men typically feel much better. So other dosing protocols that we see frequently would be twice a week dosing. So maybe a Monday, Thursday, whatever, 2 days. Typically it is 75 milligram dose or 100 milligram dose. Those are typical replacement ranges. And again, it varies according to you. So please talk to your healthcare provider before I need this dose, because we all vary a little bit, right? And so getting those levels are key. But so 75 to 100 twice a week we'll see frequently. In the bodybuilding world, and guys, I've heard all types of crazy stories. Some guys are on 250 milligrams twice a week. I would imagine that almost all of those patients have very high levels of testosterone compared to replacement. And we do know that once receptor sites are saturated, you tend to lose benefit as you go higher. So meaning the benefit that one obtained when going from, let's say, from testosterone level of 300 to 1,000 is going to be much greater than going from 1,000 to 2,000 on a serum testosterone, for example. So you lose that benefit once you start getting above the physiological range. Not to mention you can put stress on your liver, have elevated risk of hemoglobin and blood clot problems, and all sorts of mood disorders, all sorts of things, right? So the body was never engineered or made to withstand a testosterone level of 2,000, and that's just a fact, right? So replacement is what we're going for, and that can be very compatible and should be compatible with your longevity and overall health. So those should all fit together nicely. So anyway, that's all I have for today. If you like the channel, I would appreciate that. Also, subscribe.